Of the estimated 805,000 heart attacks that occur every year in the United States, roughly 170,000 of them are silent. These are not close calls that people walked away from shaken and relieved. These are cardiac events that happened to real people, people living ordinary lives, and those people had absolutely no idea. They went to sleep that night thinking it was a rough day. They woke up the next morning thinking it was indigestion. They carried on for days, sometimes weeks, sometimes longer, with a damaged heart and no warning at all. This is not a distant problem. It is happening in kitchens, in living rooms, and in bedrooms across this country right now. A silent heart attack occurs when blood flow to part of the heart is blocked, causing damage to the heart muscle, but without the classic attention-grabbing symptoms most people associate with a heart attack. Even without crushing chest pressure, arm pain, or sudden shortness of breath, the heart still experiences real, lasting injury. Most people never feel a thing. Or they feel something so mild, so familiar, so easy to explain away, that they go right on living their day. And that is exactly what makes this so alarming. The silence is not safety. The silence is the danger. If you are over 60 or love someone who is, what follows in this video may be the most important health information you hear this year. I am going to show you what is happening, why it matters, and exactly what you can do. And you are far from the only one dealing with this. When the medical community began pulling back the curtain on silent heart attacks, the numbers were staggering, not just for cardiologists, but for the public health community at large. Silent heart attacks account for 45% of all heart attacks. Nearly half. Think about that. For every 2 heart attacks happening in this country at any given moment, close to 1 of them is producing no dramatic symptoms, no emergency room visit, no ambulance call, no recognition of any kind. The person simply continues on, unaware, undiagnosed, and unprotected from what comes next. A landmark study published in the Journal of the American Medical Association looked at almost 2,000 people between the ages of 45 and 84 who were free of cardiovascular disease at the start. After 10 years, 8% had myocardial scars, the evidence of a prior heart attack. Most surprising was that 80% of those people had been completely unaware of their condition. 8 out of 10. These were not reckless people who ignored obvious warnings. Many of them were careful, health-conscious adults who simply never received a signal from their own body that anything had gone wrong. They were living their lives, shopping, cooking Sunday dinners, playing with grandchildren, keeping doctor's appointments, and carrying undetected heart damage the entire time. Now, consider what it means to carry that damage without knowing it. Ignoring a silent heart attack does not mean the heart has healed. The presence of scarred tissue significantly increases the risk of heart failure, where the weakened heart can no longer pump blood efficiently. Damaged heart muscle interferes with electrical signals, causing arrhythmias that can lead to sudden cardiac arrest. Those who have had an undetected heart attack are at a significantly higher risk of a massive symptomatic heart attack in the future. And that is what makes the silence so consequential. It is not just a missed moment. It is an open door to something far more serious, and the person walking through it does not even know the door exists. A 2018 study published in JAMA Cardiology found that participants with a silent heart attack fared progressively worse over time. After 10 years, about half of them had died, the same death rate as participants who had experienced a recognized heart attack. A recognized heart attack, the kind that triggers emergency care, that brings in the specialists, that results in treatment and monitoring and medication adjustments, carried the same long-term mortality risk as a heart attack nobody knew about. The difference was not in the severity of the cardiac event. The difference was in whether it was caught, and whether it was caught determined everything that came after. Think about the people you know over the age of 60. Think about how many of them have written off persistent tiredness as getting older, chalked up an uneasy stomach to something they ate, or mentioned an odd night of restless sleep to no one because it seemed too small to report. That pattern, multiplied across millions of people, is what this section of the conversation is really about. This is not an individual story. This is a shared national experience. And what this means for people at this stage of life, specifically, changes everything we need to discuss next. The pattern across the population is consistent, and once you see it clearly, you cannot unsee it. What researchers have found is that silent heart attacks do not behave randomly. They do not affect people without discrimination, striking at the most dramatic moments when they would be most easily detected. They tend instead to move quietly through the most vulnerable populations, and they tend to look like something else entirely when they arrive. A silent heart attack occurs when blood flow to part of the heart is blocked and the heart experiences real, lasting injury. Because the usual warning signs are absent, these events often go unnoticed until they are discovered during a routine exam, an electrocardiogram, or after another cardiac issue reveals the prior damage. That is the pattern. Not a dramatic collapse, not a moment of recognition, a quiet, almost administrative discovery during a visit for something else entirely. And by the time it is found, the window for the most effective intervention has already closed. What researchers have also tracked is how these events disguise themselves. The symptoms of a silent heart attack can include indigestion, feeling like you have a strained muscle in the chest or upper back, or prolonged excessive fatigue. None of those sensations scream cardiac emergency to the average person. They scream a big lunch. They scream a pulled muscle from gardening. They scream a week that wore you out. And for a generation that was raised to push through discomfort, the generation that kept working through illness, raised families without complaint, and never wanted to be a burden, the impulse to dismiss these signs is almost hardwired. It is not uncommon for silent heart attacks to be written off as indigestion, a sprained or strained muscle, fatigue, or just feeling run down. People who later realize they have had a silent heart attack may also recall experiencing shortness of breath at the time, or a general state of discomfort that led to a night of lost sleep. Nausea, sweating, dizziness, and an overall feeling of unease are also signs of a silent heart attack. When you read that list, how many of those sensations sound like they belong in a conversation with a cardiologist? For most people, most of the time, they sound like Tuesday. They sound like the kind of thing you mention briefly at dinner and forget by morning. Silent heart attacks do not just fool patients. They can be misdiagnosed in healthcare settings too. Shortness of breath may be mistaken for a pulmonary problem. Pain in the shoulder or arm can be misdiagnosed as an orthopedic issue. This is the layer of this problem that most people are not prepared for. It is not simply that individuals are missing the signs. The signs are being missed across the system by the people looking for them in the environments designed to catch them. The pattern persists even when a person reaches out for help. And the consequences of that missed pattern accumulate silently in the tissue of the heart long before they become visible. The pattern does not stop there. There is a second layer to this that affects this age group even more directly. When health professionals began tracking this condition across different communities and different age groups, one finding rose consistently to the surface. The older you are, the more vulnerable you are to this specific kind of threat. And the reasons for that are deeply embedded in the biology of aging itself, in ways that most people over 60 have never been told, and most doctors never take the time to explain clearly at a standard appointment. Older adults are at increased risk for silent heart attacks because the body's ability to sense and relay pain naturally changes with age. Studies show that silent heart attacks become more common in older adults, and many people only learn they have had one after an EKG or imaging test. This is not a failure of attention or awareness. It is a physiological shift that happens in virtually everyone as the decades progress. The nerve pathways that would typically carry the alarm signal, the crushing chest pain that everyone imagines when they think of a heart attack, become less reliable. The signal gets quieter, and a quieter signal means the body does not react with the urgency it should. Age-related loss of neurochemicals such as serotonin, glutamate, and opioid receptors implicated in pain modulation may contribute to altered pain processing in older adults. Changes in the aging brain have been associated with older persons' processing of and response to pain. Taken together, these studies suggest that pain is dependent on a complex neurological processing system that is affected by aging, with direct implications for the pain experience in older adults. In plain language, the biological warning system that would alert you to a heart attack is the same system that quietly becomes less accurate over time. And most people do not know this is happening. There is no announcement. There is no warning about the warning system itself. Those individuals most vulnerable to silent heart attacks fall into one of three categories: women, people with diabetes, and older adults. These groups are at higher risk because they may not experience the classic symptom of chest discomfort that we associate with a heart attack. Or the generation that grew up being told that a heart attack means you clutch your chest and fall to the floor, the version they saw dramatized in movies and television programs for decades. This biological reality represents a fundamental gap between what they expect and what actually happens in their body. Think about what that means practically. Someone who spent 30 or 40 years trusting their body to send reliable signals has reached the stage of life where that reliability has quietly changed, and nobody in their circle told them. Signs of a heart attack in women, older adults, and people with diabetes often include shortness of breath, fatigue, or a general feeling of illness instead of chest pain. A general feeling of illness. For a generation that powered through general feelings of illness for their entire adult lives, who showed up for work, cared for parents, raised grandchildren, and kept the household running through every minor ailment, the idea that a general feeling of illness should be taken to an emergency room does not come naturally. And that cultural conditioning, layered over a biological change in pain sensitivity, creates exactly the kind of gap through which a silent heart attack can move without detection. What the community-level data shows next is where the real opportunity for understanding becomes clear. What the community doesn't know yet, and what rarely gets communicated in a standard 15-minute doctor's appointment, is that silent heart attacks carry a cascade of consequences that extend well beyond the heart itself. Most of the public conversation about heart attacks focuses on the cardiac muscle, the damage to the arterial walls, the risk of a second event. But the reach of an undetected heart attack, particularly in older adults, extends into territory that surprises even people who consider themselves health-informed. Silent heart attacks, those that occur but are not detected, are a cause of increased risk for strokes, especially strokes of unknown origin. Undetected heart attacks can scar and damage heart tissue in ways that may raise the risk of a stroke, even when they are not noticeable enough to send a patient to the hospital. A stroke, not the same organ, not the same system, but connected by the scar tissue that forms quietly in the heart muscle after an undetected event and by the blood clotting mechanisms that change in the aftermath. More than 1/3 of patients who showed signs of having had a silent heart attack also showed evidence of a stroke in their brain imaging. These undetected heart attacks were closely associated with a type of stroke known as embolic stroke of undetermined source. Those strokes account for 1/3 of all ischemic strokes and seem to be triggered by clots or other vascular debris, possibly a byproduct of the cardiac scarring caused by undetected heart attacks. This is the piece of the picture that most people over 60 have never seen assembled in one place. The silent heart attack happens. The scar forms. The scar changes the internal architecture of the heart in subtle ways. And from that scar, over time, a clot can develop. A clot that travels not because of any new crisis, but as a delayed consequence of an event that felt like nothing at all. A silent heart attack is associated with an increased risk of heart failure. It also increases the likelihood of sudden death, stroke, and having another heart attack. Dangerous heart arrhythmias are another concern. These can develop when parts of the heart muscle are scarred from the loss of blood. For a generation that watched friends and family members have what were described as strokes out of nowhere, with no prior cardiac history anyone knew about, this connection reframes many of those stories entirely. The event may not have been out of nowhere. There may have been an earlier, quieter event that no one detected. And the stroke, the visible crisis, may have been the downstream consequence of the invisible one. The presence of silent ischemia is a strong mortality predictor. About 70 to 80% of transient ischemic episodes lack anginal chest symptoms entirely, what is known as silent ischemia. The lack of pain in silent myocardial ischemia increases morbidity and mortality because patients do not seek medical treatment in a timely fashion. This is not a statistic at the margins. This is not a rare edge case. The majority of ischemic episodes, the episodes in which the heart is not getting the blood it needs, happen without pain. And the community of people over 60, with their naturally altered pain response, their lifelong habit of pushing through discomfort, and their years of trusting the wrong picture of what a heart attack looks like, is navigating this reality largely without the information they need. What the community-level data shows next is where the real opportunity for change becomes clear. I want to ask you something, and I genuinely want to know. How many people in your life, family members, close friends, neighbors, do you think are dealing with this right now without knowing it? Give me a number in the comments, even a rough estimate. Because those numbers, added together from everyone watching, tell us something important about how widespread this really is. And the reason I ask is because what is happening in communities across the country is not just a medical story. It is a shared story, and the shared story has a shared solution. What people are doing that actually works at the community level and the individual level starts with one fundamental shift, replacing passive assumption with active awareness. For decades, the public understanding of cardiac risk was built around dramatic symptoms. The chest-clutching movie moment, the ambulance call, the unmistakable crisis. That model of understanding actively worked against millions of people because it trained them to wait for something that, for nearly half of all cardiac events, never comes. Experts stress the need to educate the public about the more subtle symptoms of a heart attack and to not ignore them. Seeking early medical attention is important, but education alone does not reach people who do not know they need it. What researchers found when they looked at population-level data was that the communities with the best outcomes were not necessarily the ones with the most access to technology. They were the ones where the cultural understanding of heart attack symptoms had shifted, where people had been taught to take mild, persistent, unusual symptoms seriously, where the bar for calling a doctor had been lowered, not because people were being alarmist, but because they had been accurately informed. One of the best preventative measures is having your vital signs checked regularly.
As one cardiologist noted, if you never check your blood pressure, you will never know it is elevated.
That sounds simple. It is simple, but across the population of adults over 60 who have not seen a doctor in a year or more, who have quietly assumed that no news is good news, this simple act is the difference between detection and delay. For people with a family history of heart disease, another important test is a heart scan that measures coronary artery calcium, which can find evidence of plaque disease before a silent heart attack happens. The best way to prevent a silent heart attack is to take care of your heart before problems arise. A heart-healthy diet is one of the easiest ways to start. The Mediterranean diet, which includes fresh vegetables, whole grains, and healthy fats, has been shown to lower the risk of heart disease. Similarly, the DASH diet, which focuses on reducing sodium and increasing nutrient-rich foods, is excellent for managing high blood pressure. These are not exotic prescriptions. They are anchored in food traditions that many older adults already recognize, the cooking of grandparents, the rhythms of a simpler time, now validated by decades of research. The community that eats together, monitors together, and speaks honestly about these things together survives together. And what this means for individuals, practically starting now, is exactly what we need to cover next. What you can do starting today does not require a specialist, a prescription, or a medical degree. It requires a willingness to update the picture, to replace the movie version of heart attack risk with an accurate one, and to apply that updated picture to your daily life, your family conversations, and your relationship with your own body. The first and most important step is learning to take vague symptoms seriously. Symptoms of a silent heart attack can make you feel like you have the flu. You may feel like you have a sore muscle in your chest or upper back. You might feel an ache in your jaw, arms, or upper back. You may feel very tired. You may have what feels like indigestion. If any of those sensations persist, intensify, or feel unusual in a way you cannot explain, particularly if they are accompanied by even mild shortness of breath or an unusual sense of unease, that combination deserves a phone call to your doctor. not next week. That day, do not ignore suspicious symptoms that last for 20 minutes or longer. If you think you are having a heart attack, call 911. As one cardiologist put it directly, the biggest mistake people make is sitting at home with ongoing symptoms when it could be their heart. For a generation raised to be self-sufficient and not make a fuss, that instruction can feel counterintuitive. It can feel like an overreaction. It is not. The science is clear. Time is heart muscle, and every hour of delay during a cardiac event represents irreversible loss. The second step is building a baseline. If you do not know your current blood pressure, your cholesterol numbers, your blood sugar, and your resting heart rate, you're navigating without a map. Healthcare providers often diagnose a silent heart attack weeks or months later through blood tests, electrocardiogram, cardiac catheterization, CT scan, or cardiac MRI. Many of these tests can be part of a routine checkup, and for someone who has never had unexplained fatigue or mild chest discomfort evaluated, that appointment may be the most consequential one of the year. The third step is communication. Talk to your family. Talk to the people around you. Research has found that older adults with a silent heart attack face higher risks of future heart problems, which makes awareness especially important. An informed family member who knows what to watch for in a loved one can be the difference between a bad night that gets evaluated and a bad night that gets explained away. And when health professionals began tracking the outcomes for patients whose families were actively involved in their cardiac care, the results were consistently better. The community of people around you is part of your health infrastructure, and today you can make it stronger. Together, through this video, you have just built an understanding that most people in your community do not yet have. You came into this conversation carrying the same picture most people carry: a heart attack as the dramatic, undeniable crisis. You are leaving it with something far more accurate and far more useful. You now understand that nearly half of all heart attacks happen without classic symptoms. You understand that older adults face a specific biological reason for reduced pain signaling. You understand that a silent cardiac event can leave damage that reaches into the brain, the rhythm of the heart, and the years ahead. And you know what to do with that information. You are now equipped with something real, and real knowledge shared with real people creates real change. Think about the person in your life who would benefit most from what you just learned. The friend who has been writing off unusual tiredness for months. The sibling who has not had a heart check in years. The neighbor who mentioned something that sounded vague and walked away from the conversation. Usually, when someone finds out they have had a silent heart attack, the damage has already been done. But identifying a past event can help you and your doctor take steps to mitigate risks for future cardiac events. The earlier that information reaches someone, the more it can do. I want this community of people, everyone who watches this channel, to genuinely thrive. Not just individually, together. That is not a slogan. It is the purpose behind every video we make. Because the evidence is clear, people who have access to accurate, timely, plainly spoken health information do better. They catch things earlier. They make appointments they might otherwise have delayed. They share what they learn with people they love. And that sharing, that simple act of passing real information from one person to the next, is how communities protect themselves. With expert evaluation, early diagnosis, and proactive prevention, silent heart attacks can be detected, managed, and often prevented, helping you stay in control of your heart health. That sentence matters. Control is not lost when risk is present. Control is built through awareness, and you now have more of it than you walked in with. Share this with your community today. A family member, a friend, a neighbor who could use this. Leave a comment below and tell me one thing you are going to do differently after watching. Because this channel exists for exactly this: real information, real people, real impact.
Stay with us.
Because every video we make is built for exactly